Hello, everyone. My name is Sheila Angeles Hahn. I'm a pediatric rheumatologist at Cincinnati Children's Hospital in Cincinnati, Ohio. I'm really excited to have been invited to talk to you today about eye issues in children with JIA, specifically focusing on uveitis. Much of my clinical care and research have been focused on making sure that children with JIA and uveitis maintain the best vision possible. The subjects that we'll talk about today are focused on questions that my families and patients tend to ask me when they come to see me in clinic. So first, what is uveitis anyway? What increases a child's risk for developing uveitis? Why do children with JIA need to see their eye doctor regularly? And if uveitis develops, how do we treat it? Families and patients are often very surprised to learn that uveitis, which is inflammation in the eye, develops in children with JIA. So the uveitis occurs in the uvea. So you have inflammation in the uvea, which is part of the eye. And uvea is actually a term that comes from the Latin word for grape, because as you can see, the eye is shaped like a grape. Although uveitis can occur even when a child doesn't have a specific rheumatic condition, it can be associated with rheumatic conditions where JIA tends to be the most common. So in fact, anywhere from 10 to 20% of children with JIA can develop uveitis. It tends to be chronic, which means it's present for a long period of time. Both eyes are usually affected, and most importantly, most children won't have any symptoms. So it's extremely important that children are screened regularly by their eye care specialist for uveitis, and they have scheduled visits. It's also important to know that the type of JIA that a child has can influence their risk for uveitis. So for example, in the box on the lower right, the JIA categories that are highlighted in green tend to have an increased risk for uveitis development. So back to the question of how often do I need to go see the eye doctor? So the frequency of these visits is determined by different risk factors. These include the type of JIA that a child has, the age that the child developed JIA, how long they've had their JIA for, and their ANA status. So children who have the highest risk are those with these subtypes listed. So oligoarticular, which means 4 joints or less are involved, polyarticular, which means 5 joints or more are involved, but who are rheumatoid factor negative, psoriatic JIA, and undifferentiated JIA. Children who are younger than 7 years of age when JIA occurs, or have had JIA for 4 years or less, so they are early in their JIA course, and if they have a positive ANA. I wanted to share this figure with everyone because it shows the frequency that a child has to see their eye doctor based on their risk factors. So children have to go anywhere from every 3 months, every 6 months, to once a year, and your doctors can help you determine how frequently these visits are needed. But as an example of using the top boxes, a child who has one of these JI categories, either oligoarthritis, polyarthritis, that is RF negative, psoriatic arthritis, or undifferentiated arthritis. If they are ANA positive, they have had JIA age of onset less than 7 years old, or they are earlier in their disease course, so they've had JIA for 4 years or less. These children tend to be at highest risk and need to be screened by their eye care specialist every 3 months. So how do you know if your child has uveitis? Unfortunately, in most cases, a child won't have any symptoms, so they won't complain of blurry vision, eye pain, discharge, redness, really until there is damage to the eye. So there is a risk for permanent vision loss if uveitis is not detected or treated early. Some children can complain of light sensitivity when they go out into the bright sun, so they may ask to wear a cap or sunglasses. For the most part, uveitis is chronic and without symptoms, but there are some children who will develop an acute uveitis, which tends to have symptoms and lasts for a shorter period of time. And these children tend to have other types of JAI categories, particularly enthesitis-related arthritis or a spondyloarthritis. So for these children, uveitis can have symptoms such as eye pain or redness, and it tends to occur in one eye. So when this happens, it's extremely important that they are evaluated by an eye doctor very quickly. What happens if uveitis is diagnosed? First, it's really important that eye exams occur regularly to monitor if the eye inflammation is getting better or worse, and if the treatment that your child is on is actually working. Other factors that can determine how often the visits occur are whether or not the uveitis is active, if there is any concern that there is a complication or damage to the eye, such as an increase in pressure in the eye that can be seen in glaucoma, cloudiness of the lens that can be found in cataracts, or swelling in the back of the eye, such as in macular edema. The other important factor are the medications that your child could be on, such as eye drops or systemic medications. So when they're being changed, it's important that your child is seen a little bit more frequently. So these visits can occur in the beginning anywhere as frequently as weekly to later every 3 months when uveitis is better controlled. Families also often ask me what the grades mean when their eye doctor examines their child's eye. So what the eye doctor is doing is they're actually counting the white blood cells in the eye. So as you can see in this table, each grade in the left column corresponds to a certain number of cells seen as shown in the right column. So what we really want is for there to be grade 0 where there are no cells in the eye. How do we treat uveitis? The children who develop uveitis need treatment quickly, and steroid eye drops are the first treatment to control the inflammation in the eye. There are different types of steroid eye drops, and they can be instilled in the eye as often as hourly to once a day. It's important that these eye drops are given regularly so the inflammation is controlled. There are also other eye drops that can be used to keep the pressure normal when a child has glaucoma, or to keep the eyes dilated if there is some damage to the eye. The next question, though, is what happens if the eye drops are not enough to control inflammation? What if your child is unable to stop the eye drops, or the uveitis returns after you stop it? Often, we recommend that these children are started on other medications. We worry about the continued persistent use of steroid eye drops because they can cause side effects such as cataracts and glaucoma. And we also worry that continued inflammation in the eye can cause damage. So the systemic treatments that are used are very similar to those that are used for JIA. So we also use methotrexate either alone or in combination with infliximab and adalimumab. And the treatments that are used are determined by the findings in the eye. And similar to JIA, treatment is needed for several years. So I want to emphasize that these visits to the eye doctor are very important for several reasons. First, for children who have a diagnosis of JIA, it's important that they undergo regular visits to screen for uveitis development, especially since uveitis tends to not have any symptoms. So we want to make sure that uveitis is detected and treated early. The other type of visit is to monitor inflammation when a child is diagnosed with uveitis and the response to treatment. So it's really important that the whole team works closely together. We emphasize that collaboration amongst pediatricians, rheumatologists, ophthalmologists, and other care specialists that your child is seeing is very important. So I hope that this information was helpful for you today. If you have any questions or comments that you'd want to share with us, please join me with Dr. Virginia Utz, who is a pediatric ophthalmologist that I work with at Cincinnati Children's. We'll have a live session and are excited to answer any questions. So we hope to see you there. Thanks for watching this talk.